Hello everyone and welcome to my channel. My name is Edna Dapa, and in my previous video I spoke about cervical cancer. Today I will be moving further up from the vulva, vagina and cervical cancers to discussing endometrial or uterine or womb cancer, one of the gynecological cancers. Join me as we continue impacting vital information on health matters to women of all ages. Uterine cancer is common among postmenopausal women, so we must get involved supporting our mothers and grandmothers with this awareness and education. Please be aware that this discussion is not diagnostic, but awareness creation of the disease. The uterus is the main organ of the female reproductive system, in which the fertilized egg is implanted. The uterus plays a major role in the reproductive cycle, fertility, and childbearing. The uterus has 3 layers that together form the uterine wall. The outermost layer is perimetrium, and it secretes a watery serous fluid, lubricating the organ. The middle layer is called myometrium, that allows the expansion of the uterus during pregnancy and contracts the uterus during the delivery. The endometrium is the inner layer that lines the lumen of the uterus, which prepares and enables the implantation of fertilized eggs. If the egg cell is not fertilized, it is shared with the endometrium layer in a process called menstruation. Uterine cancer is the most common of the 5 gynecological cancers and quite popular among postmenopausal women, although it can affect anyone with a uterus at any age. The disease begins in the layer of cells that form the lining of the endometrium of the uterus. About 90% of uterine cancers are diagnosed as a result of postmenopausal bleeding being reported. Other symptoms include bleeding between periods, bleeding that is unusually heavy, pain in the pelvis, pain during sexual intercourse, abnormal heavy or irregular menstruation, weight loss, abnormal watery or blood-tinged vaginal discharge. Most people with abnormal bleeding may not have gynecological cancers, so it is important to get medical advice with any concern. The exact cause of uterine cancer is not known, although several factors could increase the risk of developing the condition. Age is a risk factor for womb cancer, as the condition occurs mostly in women aged 60 years and above. Another factor that can increase the risk of womb cancer is unopposed estrogen. The cancer is linked to the body's exposure to estrogen after menopause. Such estrogen could cause the cells of the endometrium to divide and increase the possibility of womb cancer. Estrogen thickens the endometrium in preparation of conception. If pregnancy does not occur, the level of progesterone drops abruptly, thereby causing the uterus to shed its lining in a process known as menstruation. Presence of estrogen in a situation where there is lack of progesterone prevents the uterine lining from shedding in the absence of pregnancy. Rather, the lining continues to grow and thicken. Endometrial hyperplasia is a rare condition that tends to occur during or after menopause, when the lining of the uterus becomes unusually thick because of having too many cells. This is often caused by excess estrogen without progesterone. Therefore, the lining is not shed. The endometrium may continue to grow in response to estrogen, and the cell lining may become bloated and abnormal, increasing the risk of developing endometrial cancer. Obesity is also a risk factor, as the condition could contribute towards elevated circulating levels of estrogen. Fat cells are loaded with aromatase and enzymes required for the biosynthesis of estrogen. If there is lack of progesterone to counter estrogen produced from this pathway, there will be an increase in the possibility of developing womb cancer. Other conditions such as polycystic ovary syndrome (PCOS) could increase the risk of developing womb cancer because of high levels of estrogen in women with the disease. Tamoxifen hormone used for the treatment of breast cancer could put women at an increased risk of developing womb cancer. However, this risk is outweighed by the benefits that tamoxifen provides in preventing breast cancer. High levels of insulin in the body could increase the risk of tumors and are also recognized as important contributors to the development and the progression of many kinds of cancers. Certain factors could inhibit development of womb and endometrial cancer. During pregnancy, the level of progesterone is high, whilst estrogen level is quite low. These hormonal levels during pregnancy have a protective effect on the lining of the womb. So women with no reproductive history or have not had children could have a higher risk of womb cancer. Diagnosis of uterine cancer could start with physical examination of the womb with possible further tests such as transvaginal ultrasound scan (TVS), a procedure that uses a small probe as a scanner placed directly into the vagina to get a detailed picture of the inside of the womb. Hysteroscopy can also be applied, and it is a type of telescope inserted into the womb to look at the lining, at the same time taking a sample or biopsy from the womb or the endometrium. The sample is then examined for cancerous cells in the laboratory. Cervical screening tests may occasionally detect the condition because the tumor cells could shed off into cervical smears and are spotted by a cytologist. If endometrial cancer is diagnosed, a further test will be required to determine what stage the disease is. Staging allows doctors to work out how large the cancer is, whether it has spread, and the best treatment option for the female. Further tests may include an MRI scan or CT scan to check if the cancer has spread, a chest X-ray to check if the cancer has spread to the lungs, further blood tests to determine the general health of the woman and how well some of the organs are functioning. The most common treatment for womb cancer is the surgical removal of the uterus or hysterectomy. Early diagnosis of uterine cancer can often have a good prognosis. We can see that endometrial or uterine cancer is a gynecological cancer that is prevalent in menopausal women. This group will find abnormal vaginal bleeding very difficult to comprehend. So we must support this population on education and awareness of this subject. Progesterone is almost absent in menopausal women, so any presence of estrogen may not be countered, and this could put the woman at the risk of endometrial cancer. Many thanks for watching, and please like and share this video to your friends and family, and I will see you next time when I will be discussing ovarian cancer. See you soon.